M23 rebels seized parts of eastern Congo earlier this year as part of a rapid offensive that left thousands dead, including children, and forced hundreds of thousands from their homes.
During the most intense phase of this year's conflict in eastern DRC, a child was raped every 30 minutes. We're not talking about isolated incidents. We're talking about a systematic crisis. We are seeing survivors as young as toddlers. It's a weapon of war and a deliberate tactic of terror.
UNICEF says children constitute up to 45% of the nearly 10,000 cases of rape and sexual violence reported to protection actors in the space of just 2 months. Given the fear and stigma surrounding sexual violence, the organisation fears it's just the tip of the iceberg.
In just one of the hospitals I visited, 127 survivors of rape had no access to the post-exposure prophylaxis kits. That is a direct consequence of rapid funding cuts. These girls and women are enduring the most unimaginable horrors, and they are no longer getting even the most basic medical care that they need.
The US was the main provider of humanitarian funding for the DRC, but foreign aid freezes imposed by the Trump administration have now endangered critical humanitarian programs. UNICEF says that if it's unable to fill the funding gap, 250,000 children will miss out on vital services for gender-based violence.
Earlier, we were joined by the Chief of Child Protection, UNICEF in the DRC, Ramatoa Toure, talking about this latest report.
What we can see and what happened during those 2 months is that basically no child or no woman actually had a safe haven. Anyone could be subjected to sexual violence and to rape. So we can see obviously, and we know that being subjected to sexual violence leaves lifelong trauma. But what we know also is that if we manage to provide assistance to the survivors, if we manage to provide them with mental health, psychosocial support, also legal support, and obviously medical support, this traumatic experience can only become one event in their lives. And we've also seen amazing young girls, amazing women who have been able to go through, unfortunately, this unfortunate experience, but then continue in their path of lives. And this is why it is important to act. What is happening now in Eastern DRC in terms of sexual violence, as James said it, is not isolated incidents. We are facing a real catastrophe.